Hello again. I'm Dr. Jim Coyle, and this tutorial focuses on how social workers use the social determinants of health to conceptualize how we work with clients presenting life challenges with their health. Consider the major physical health challenges that you are used to seeing in your clients and yourself and your families. Things like coronary disease, cancer, obesity is a big one these days with poor nutrition and exercise. HIV and AIDS is something that is often something that social workers work with. And of course, COVID-19, which everybody is dealing with the effects of the coronavirus these days. And it gives us an opportunity to kind of think about, okay, how's our own personal experiences in dealing with this, paralleling the client issues that are coming from this, and what can we do when we're working with clients who are very concerned about this. It's important to ask yourself, when we talk about physical illness like this, what is the role of social work related to these health challenges? And to think about that for a moment, because social workers don't have medical degrees. They're not going to be, giving medical services, but there's so much more to it than that. And that's what we're going to use the social determinants of health to give us some ideas about that. Now, as I've mentioned before, it's important to kind of get into your mind what you've gotten from the readings. And I've also suggested that you view this particular video, which is a short overview that talks about the social determinants of health. If you've not already watched this video, I've put the link in the comments. It's important for us to recognize that the factors influencing a person's health include a broad range of things: who they are, what they do, the conditions in their environment. Health is shaped by money, by power, by the resources, and as a result of that, it can often be influenced by inequities. Determinants of health are a broad range of personal, social, economic, environmental factors. This slide contains some examples of the many different factors that are associated with health. And I want to remind you once again that the contents of this slide are included in the course website so that you can look at them a little bit more closely and use them if in your kind of coursework related to physical health. The social determinants of health are broad factors, but it also, as the video mentions, it is kind of dependent upon the individual's place in society, their income, their education, their employment, but also experiences related to discrimination and racism and historical trauma, particularly for Indigenous people, LGBTQ, Black Canadians. And I want to point out to you, notice how we have a little bit of overlap here with anti-oppressive practice and anti-racism that we talked about in a previous lesson, as well as the historical traumas that occur, so that life course is a very big important aspect of this. So that what you're going to find is that there's many overlapping qualities in the theories and perspectives that we use to kind of assess what's going on with our clients and to help them. So I want you to take a moment to ask yourself and consider, what is your reaction to the reading and to the video? Marmot's statements that poverty and inequality cause increased illness and death rates is a very strong element that maybe people don't traditionally think about in terms of physical health. He and his colleagues in the second article propose a number of action statements. And you notice those action statements don't have to do with medical, having better medical care, although that's always nice, but it's improving daily living conditions. It's addressing power and money inequalities. It's to increase the use of the social determinants of health and have people know that these are important aspects that influence our health. The video discusses the number of structural and intermediary determinants of health that I mentioned in terms of how people are influenced by their environment and how that influences their health and their ability to deal with physical illness. So once again, I'm asking you to jot down your ideas. When you think about all of this, when you read about all of this, I'm asking you to think about what are the points that you're learning that are going to help you when you're working with a client who has some specific health issues. So as a social worker, how does the social determinants of health help you apply to this? I'm particularly asking you to consider how it's applicable in regards to the coronavirus. Everybody today is affected by that. One of the big things is the reason that I'm doing this online is because we can't have classes, face to face. Many of you are working in situations where you're doing some online work, but you're also working in situations where, as a professional, you have to work with people face to face and take precautions in order to try and protect your health and their health. This causes a high degree of stress for people, both clients as well as yourself. And what are we doing in order to kind of affect that? One of the things that we're hearing about that fits with social determinants of health is that people who are from minority, people who are from lower socioeconomic class tend to be more affected by the COVID-19 virus. People are having difficulty with the isolation. And how do we deal with that? Children are falling behind in terms of their education because of not having the direct attention, and are having some difficulties being isolated and working online. Children who are going to school are also worried, at least their families are worried about how this is going to affect their health. All of these are things that social workers may be talking with people about and looking for social policy changes and structural assistance that may be able to help people manage this better in terms of community kind of networks, even if they're online, in terms of helping people get the inoculations that are coming out. So there's a lot of things that social workers can do in regards to this. And so jotting down that is going to help you make the connection between this and the in-classroom exercise. Now, the in-class exercise is going to ask you to compare the social determinants of health with a lifestyle choice perspective, which is that people make choices about, their own health. And that's really the major factor that's associated with this. And that's the basis of a lot of social policy in health. And so the social determinants of health is going to say, that's a little bit different. And so the exercise is based upon how do you compare those things, as well as then saying, okay, what's that going to mean in terms of how you're going to work with clients? So from this article, from the articles that were assigned, from the video, from what I have just briefly presented, what have you learned? How has learning about social determinants of health influenced you and your understanding of how you can work with clients who have physical health problems? Keep in mind that social workers have been very involved in many kind of medical organizations helping people with health problems. Social workers are very much a part of hospital staffs. They're very much a part of long-term care staffs, community medical practices, and community clinics, where social workers are noted for having something to offer. What are your own experiences with this? And how does this particular theoretical perspective help you understand that? Let's talk about this more in class.